Welcome to Therapy Facts with Dr. Jenn. Today we are talking about the therapy facts from the interview between Monique and Shannon Sharp at Club Shay Shay. So, Monique graced the couch this past week and she had plenty to say. So, the first point we're going to address is finding and using your voice. Listen, Monique has this therapy point on lock and has been practicing it ridiculously consistently for the past 10 plus years. Now, I will tell you that coming to therapy to find one's voice is one of the most common reasons for coming to therapy. So, the issue with someone hurting a person typically is that it causes so much pain and it has such a negative impact on a person's life because very often the person does not acknowledge or express the pain that they are experiencing or have experienced at the hand of someone else. And so, very often, the first thing that trauma experiences rob us of is the ability to even identify the pain to ourselves. And let alone anyone else. And so, we swallow the pain, we swallow the incident. Very often, we keep silent even when there is no threat to keep silent. And as a result, by the time I see people as adults and older adults, people have not ever expressed to anyone, themselves or anyone else, the pain of the experience that they had. But they have the pain of the effects of the trauma for years and years, sometimes decades and decades. And so, one of the first things I teach a person is to articulate the experience of the event, of the trauma, of the assault, whatever it is, to themselves. And let me tell you, finding the words, finding the voice to articulate and tell oneself one's pain story is a treacherous process. And so, with Monique being able to show the end result of such a process, it's one of the greatest examples that I can show my clients. Hey, look at Monique. She is definitely on the outer edge of the continuum of finding and using your voice, but she is definitely someone to be emulated. Now, the process of finding one's voice again starts with even articulating the expression of pain, heartbreak, sorrow, and betrayal to oneself. Once that happens, and that can take many sessions, many tries, many months. Once that happens, the next step is to then articulate that pain, that heartbreak, that trauma to the person who perpetrated it. Now, typically that is done in a safe way so that the client is perhaps writes a letter, dear so and so, dear perpetrator, this is what you did to me, and this is how it made me feel. This is the impact that it has had on my whole life or my life, depending upon how recent the trauma was. And this is what I need you to make amends for. Now, typically, these letters are never sent because the person either is no longer present, no longer living, no longer available, or there's no longer any communication. However, the importance of that person being able to address the perpetrator is so important to processing the whole event. And processing is super important for being able to work through, do any forgiving that's going to happen, and then being able to move forward without the burden of the trauma weighing down one's life. And so, those are two major steps in finding one's voice and using one's voice. Again, Monique's use of her voice for the last 10 plus years is a great example of the idealistic outcome of finding and using your voice in therapy. Being able to say very publicly, this is who hurt me, this is how, and this is my experience of the hurt, and this is what I need for recompense, for compensation in order to make this thing right. Say what you want about Monique, her voice is well developed.